We see all types of wounds, arterial, venous, diabetic, of course, pressure wounds, post-traumatic, post-surgical wounds, patients who have cancerous tumors on their legs. We will take the Dermacyn and just soak it on the wounds for 5 to 10 minutes. And it replaces our saline. I don't use saline, I just use the Dermacyn. We use it for every wound. We do a nice soak with it before we debride our patients. I have patients that are on home care that get it through various pharmacies that we have it stocked. Maybe 400 or 500 patients. Easy. Easy, if not more. I can't even count that because we use it with every wound patient. Everybody. Even post-op. When patients come back post-op, they have a lot of dry blood. I'll put it on a little 4x4 and clean off the wound and clean off the incision. So everybody. Helen actually had a traumatic ulcer here. She actually hit her leg, was hit by her car door. And it was heavily contaminated with bacteria. And so we normally prep her out with, we did a chlorhexidine scrub because we keep her in a compression bandage because she does have venous reflux. But she has this very, very, very thin skin as well. So what we do is we had her soaking in the Dermacyn for about 10 minutes. Just we put a 4x4 on and soaked it. And then I'll take a little more Dermacyn and just kind of squirt it right in the wound. And then we simply lay that on the wound. We'll need some prism now. And a little more Dermacyn to wet the graft. Over the top. Okay, Bobby got some adapting. And we'll give it another little shot. Just so that it stays right on there. Program by Johnson & Johnson is also very excellent for holding the Dermacyn and then releasing it into the wound. I don't use any topical antibiotics because I have the Dermacyn, and I was never a firm believer in topical antibiotics as well. And I was always trying to find something to use instead of using a topical antibacterial. So now that I have the Dermacyn, that's all we use. It really doesn't get any easier. It comes in a squirt bottle. We simply take off the dressing, and we take 4x4s, we soak the 4x4 with it and just lay it on the wound and just let it diffuse in. And then as I'm doing my dressing, as I do a little debridement, I'll take the Dermacyn, squirt on the wound, debride a little bit more. But when we put the dressings on, I use it with all my grafts. I use it with Prism and Promogran that we use a lot here. I'll even use it if I'm using an alginate. I'll soak some of the alginate in it and then put it on the wound as well. Incidentally, use it through the wound vac and the wound vac can still. And I use it with all kinds of grafting. I've never had a problem with it. Very easy, very simple to use. You would just use it as if you were using a saline bottle. And again, I think one of the remarkable things about it was the analgesic and the anti-inflammatory effects. Patients that we used it on actually had some very severe pyoderma gangrenosum with severe pain. And after they would apply it every day at home, early as 2 weeks, they had reduction in their pain and the inflammation, as well as the colonization of the bacteria that was in the wound. And now we, as we say, we can we rid these wounds of nasty infections with little of just as one-time application per week. I've disseminated this out to several people that I know, vascular surgeons and wound care specialists and podiatrists as well, up here in North Jersey and especially in Philadelphia, and at very large wound care centers. And I've discussed that with them, and they were very excited, and they're trialing it now. So, I mean, you can't beat its antibacterial capabilities, anti-inflammatory, and even that mild analgesic effect that it does get on wounds. I haven't had any complaints from patients about it. And I've used it for other things. I know these are off-label indications, but if you have a cold sore, I gargle with it. It knocks it out in 2 or 3 days. Patients are knows they're using it for fungal nails. It gets rid of the fungal nails. So it has many other uses that are not on label, but I'll tell you, it's a good mouthwash too.